when our doctors are not really working as they are supposed to. They are on strike, and we want to remind all the doctors in this country that life is very variable. When life is gone, you cannot revert it. Irrespective of all what may be surrounding our lives, we charge and we ask our doctors to think about Kenyans at a time like this.
The ongoing strike is making worse an already strained healthcare system, leaving thousands of patients without access to essential medical care. In many government hospitals, clinics are abandoned, ICUs are closed, and referral hospitals are even declining taking patients. This is dangerous, for many lose their lives. The efforts that the Deputy President is making in the war against illicit alcohol and drug and substance abuse is laudable and needs to be supported by all. The effects of illicit alcohol and drug abuse and substance abuse are too obvious, and they are dire.
The NADCO report, as adopted by Parliament, will be implemented, and we have all the goodwill to implement that report in the manner it was passed. We have already published bills. The IEBC bill to reconstitute a new commission is already published. And as soon as we reopen Parliament in another 1 week, we shall begin work on that bill and all the other bills that we have published. So, Kalonzo asikuwe na wasiwasi, ati kuna bill haitapitishwa, ile koti imesimamisha ama imeweka injunction kidogo. Hiyo ni mambo ambayo tutapambana nayo kotini.
Na maafisa a borithi